So, Bismillahirrahmanirrahim. Can I welcome everyone to Deeplish, our popular health seminars, series of seminars. This is the seminar which is understanding, managing and reducing the risks of diabetes. Of course, very important topic. We have our distinguished guests, Dr. Louise, Dr. Ruqayya, Dr. Khalid and Lori, and our genes and health team, and of course Living Well, and our sister from eye screening. So welcome all of you. So this is our health seminar. So to lead, I invite Dr. Louise Tomko to introduce and of course give you a background and start the session.
Thanks, Sahil. Welcome everyone. It's great to see you all here this evening. I have to say, a little bit of a younger crowd than we usually have at Deeplish at these health seminars, which we were just talking about how great that is, because health education is obviously really important right throughout the life course. So thank you for coming and welcome to all of the first timers at these health seminars. Tonight we're going to talk about diabetes. Ruqayya is my colleague from Salford Care Organisation. Salford Royal Foundation Trust is where we work. And she's going to talk you through diabetes, and then we're going to open up for a bit of a discussion. And Laurie here, do you want to just wave, is one of the diabetes specialist nurses, more local to Rochdale. So we'll sort of have more of an open discussion and questions at the end of the talk. These health seminars have been going for, I think, a year now. Our next session will deliver early in 2025, and we're going to focus on CPR training and BLS, basic life support. So one of the resuscitation officers is going to come from Rochdale health organisation, and bring in some dummies so we can all practice doing CPR. We've also got some other sessions in the pipeline about things like gastritis, about liver disease, but as always, we're really open to hearing your suggestions about what do you want to hear about, what are you curious about, what do you think is a problem that you don't fully understand, is there anything that you want to ask us, and if you have suggestions for future topics, just get in touch with either me, Ruqayya, Laurie, Sahil, any of us, and please do give us your ideas, because we've got contacts of doctors and nurses and specialists in lots of different areas who'd be very happy to come to Deeplish to talk to you all. So I'm going to stop talking now, and I'm going to hand over to Ruqayya, who's going to deliver the session. Thank you so much, Ruqayya.
Thank you. So thank you, Louise, for that introduction. I'll just introduce myself again. So my name's Ruqayya. I'm one of the foundation doctors at Salford Royal. So I've worked with Louise for a bit, and thank you for inviting me to do this talk. So we're going to be talking, this whole theme is around diabetes, and we're going to be talking about what diabetes is, how we manage it in the communities, both from a doctor perspective and also from a community perspective, what we can do ourselves, and how we can reduce the risk of getting diabetes. So I put the aims there, but we kind of talked about them. Today is going to be more focused on type 2 diabetes. We'll touch on type 1, and we'll look at the risk factors for it, what we can do to spot it, the signs and the symptoms, how we manage it, and then we're going to be talking about diet and fasting with diabetes as well. So I thought a show of hands, just so we can get a bit of perspective. How many people either have diabetes or know somebody that has diabetes that's closely related? Yeah. So, and I need to put my hands up as well. It's quite common. So what it is, it's a condition where your body can't either produce insulin or it doesn't use it properly to lower your blood sugar. So the sugar in your blood just stays high. And the types that we have, we've got type 1, type 2, and then gestational diabetes, which you can get during pregnancy. So why it matters, like we said, it's really common, as we can see around the room in the show of hands. Around 5.6 million people in the UK have diabetes, and interestingly enough, around 1.4 million don't really know that they have diabetes. So it's always a topic that's worth raising within the communities. So I thought we've mentioned insulin quite a bit, and I don't want to get into it to make it too complicated, but it's a hormone that's produced in one of the organs in your body that's just underneath your stomach, called the pancreas. And this pancreas, it makes this hormone, it goes into your blood, and then that works by lowering your sugar levels. So if you either don't produce it, you won't be using it well enough to lower that sugar level, so it just stays high. And then, like we mentioned, we've got type 1 diabetes, which is usually in younger kids and younger adults, and this is where the body doesn't make any insulin. And with these cohort of patients, they tend to need to stay on insulin, usually lifelong, so they'll need to inject insulin. Whereas type 2 is more common in adults and can develop over a long period, and it's where sometimes you don't make enough insulin, or sometimes your body just doesn't respond to it. And this one can be managed a bit differently, and we'll talk about that at the later stage as well. So yeah, like I said, the focus is more on type 2. So I know you guys mentioned, some of you put your hands up for diabetes. Do you know anything that can make you at higher risk of diabetes that you've heard of? Yeah? Yes, definitely. So your diet is one of them, definitely, and it plays a big role. Does anybody know any other thing that can cause you to be at risk? Runs in the family, yeah, exactly. Too much sugar, definitely. Did you have? Yeah, exactly. So I like to split it up, because it's no sense just listing, oh, this is all the things that makes you higher at risk. It's what things we don't have control of and what things we've got control of within ourselves that we can do and try and change. So you've got your genetic and family history. So if you're from an African, Caribbean, Black African or Chinese or South Asian descent, automatically at higher risk of diabetes. It doesn't mean you will get it, but you're definitely at higher risk. If you've ever had gestational diabetes during pregnancy, you're likely to develop diabetes. And I'm sorry guys, but it's slightly more common in the men than it is in the women. And then family history, if you have a parent, mum and dad, sister or brother, or even child that has diabetes, you're at higher risk too. And then looking at lifestyle, so these are the things we can try and control and try and change. So obesity and being overweight, your diet, which is a big role as well. If you ever had or have high blood sugar or cholesterol, and smoking too. So I've put a few pictures up there to kind of demonstrate how diabetes shows itself. So can anyone have a guess what the symptoms might be? Yeah?
Fatigue first, and then obviously you need to use the bathroom more often.
Yeah, exactly. So that guy in the middle is really tired, so he's fatigued. You can get really thirsty and you need to use the bathroom a lot. Can anyone guess what thing is the most common though? How does it commonly present? Being tired is more common. So I thought that as well, but actually it's just no symptoms. So more commonly you might find that people go and get their bloods done or get their bloods checked, and that their blood sugar is high. But like we mentioned, you can either get thirsty, you can have a dry mouth, you might go to the toilet quite often. If you have any cuts or grazes, they might heal a lot slower compared to other people. And then at a later stage, you might see changes to your vision. You might get blurred vision. And we have a really handy post at the back there where you can try on some glasses. So I definitely recommend going there for a bit more information on your eyes and diabetes. So how we tend to manage it, first line is usually you go to the doctor or see a specialist nurse and they'll advise you on certain changes you can make to your diet and lifestyle. So changing the kind of things you eat, making small adjustments and trying to get a bit more active. And then if that doesn't work, we've got certain medications that we can offer, like metformin, certain things that you can take orally. And then we can try maybe a combination of those, but if all of those fail, we tend to go on to insulin injections. And then while you're being managed for diabetes, you will get regular checkups, you'll see a specialist nurse, you'll have routine blood tests and get your eyes and foot checked as well. And the GP in the community should be able to advise on certain programs as well, so for education and diet. So you wouldn't be doing it alone, there'd be support groups out there as well that you can utilize. And then I'll quickly talk about diet. I think Laurie might have some good information about this later, but there's different food groups that we look at. You're probably aware of them, but I'll touch on them quickly. But carbohydrates is one of the things that we might focus on because it can affect your sugar levels vastly and even the way your insulin is used. So you've got the different types, simple and complex. So we tend to advise to have more complex carbohydrates, especially your fibers that are really good for your gut health as well. And this is things like your whole wheat bread and like seeds, but we'll talk about that in the next slide as well. So yeah, I've mentioned fiber again there because it's really important. So yeah, nuts, seeds, fruit and vegetables have high fiber. And it's really good for your digestive system, and that in all helps to keep your glucose and cholesterol down. And then protein. So there's a lot of meats that we tend to eat in our diet, like chicken and red meats, that do have high protein, but there are better alternatives that you can use, or if you do have them, just have them in smaller amounts. So lentils, chickpeas, we've got paneer and fish there as well. And then even when you're having these proteins, the way you cook them makes a difference as well. So trying to grill the meats instead of frying them. And then with fats as well, so I'm from Algeria, we use a lot of butter in our food. We put it in the couscous, we put it in everything. So it's trying to swap out those little things that you know you eat regularly, because we have couscous quite regularly. If we use a different oil instead, or try steaming and grilling and baking instead of frying. And then lastly, dairy is another food group as well, which is your milks, your like we mentioned, creamy desserts. So when shopping, if you are craving something sweet, perhaps like getting a unflavoured Greek yogurt and popping some honey on top rather than the sweetened version could be a healthy option. And I put a few more tips here as well. So it's good following all of that, but another thing to remember is portion control. So how much are we eating and the variety that we're eating to make sure we're including different food groups, because that has an effect. And then choosing carbohydrates that break down slowly, like the complex ones that we talked about. Your style of cooking, so grilling, steaming and baking, trying to get a lot of veggies in your diet as well helps. And then for diabetes, I think they tend to recommend to try and avoid sugary drinks altogether if you can, and replacing it with water and teas. But all of these tips that I've given you, I mean, we tend to live a certain lifestyle and it's based on our motivation. But if you feel like you can't cut something out, to just at least try and reduce it or have it when it's a special occasion really helps as well. And there's a really useful guide on Diabetes UK that goes over, I think, Afro-Caribbean cooking and South Asian cooking, and it has certain replacements that we can make in recipes, and it actually goes through the full recipes. I think there's one at the back, but they're also available online to use too. And if we talk about diet, we have to talk about exercise as well. So I can't remember a situation where I've told someone that exercise is bad for them. Like, you can't go wrong by just moving your body. So with diabetes, type 2 especially, it helps you use your insulin better. It gives you more energy, so that fatigue can help to be lifted a bit with exercise. And as you're getting older as well, it can help with your joints. And something that we don't always talk about, but it can be really good for your mental well-being to just try and get a few, like half an hour of exercise a day. So like I mentioned, the recommendation is around half an hour, and it doesn't matter what you do as long as you try and do something, even if it's like walks with the family or whatever you think you can keep up over a long period and maintain. And then lastly, fasting with diabetes. So when the month of Ramadan comes, it's really spiritual and you want to engage. If you do have diabetes, it's always worth consulting with a healthcare provider first, because if you're not eating and you're taking the medication, that medication can lower your sugar levels a bit too much. So especially if you're on medication, you should speak to someone, whether it's a GP or a specialist nurse. And if you are fasting with diabetes, just try to check your blood sugars regularly. And if you feel unwell, if you feel sick or faint, then just to break your fast. And one of the things, I think this is not just for diabetes, but during suhoor and iftar, if you have the more complex carbs and proteins that release energy slowly, so this is for anybody, and drink a lot of water. I know we all wait till the last second to just gulp like a litre down of water, but if you try and drink a bit more, it'll help you feel fuller throughout the day as well. Thank you very much. Do you have... Thank you. So I think the plan is to open up for any questions. Yes. Yep. I'll bring Laurie up here.
Just to let you all know, there's some resources all around the room that you're more than welcome to come and take. I've got some in English and Urdu as well. And obviously the other services have got theirs as well. Any questions, guys?
Anything about type 1, type 2, or just general lifestyle questions? More than happy to.
What I want to know is it a myth now, or because sometimes I hear people online or Facebook, they say diabetes is curable. What the doctors are doing is just giving you medicine to keep it at that level. But if you do ABC or whatever, this and that, it's curable. So I want to know, is it curable or is it just a medicine forever?
It's a great question. Once you get diagnosed with diabetes, you never lose that label, unfortunately. Now, what we find, I've been a diabetic specialist nurse for 10 years, and what we find is that if you are diagnosed within the first 2 years, 2 to 5 years, depending on who you are and how well you manage your self-management, you can put your diabetes in what's called remission. So if you heard the word remission, you hear a lot in cancer. You can actually do it in diabetes. So we have had patients who've done excellently with support through our team, through the GPs, practice nurses, and they have managed to reverse or put their diabetes into remission. Now, do we think that's easy to do? No. So with what Ruki have said today, then patients have gone away and worked very, very hard with watching the carbohydrate portions, keeping active and keeping that as a lifestyle change and choice. Because the minute they stop, what do you think happens? It comes, yeah, your diabetes will come back. Okay, so it's the lifestyle change and that maintenance. Now there is, research girls are here, there is a research trial for patients. It's called the DIRECT trial, and it's a low-calorie trial that's out there, and from the evidence, there's like 46% of every patient who attended that trial reverted and put their diabetes into remission. Now, these patients, there's a criteria you need to meet, but it's usually the newly diagnosed ones. So if you've had diabetes many years and you're on lots of medicines and insulin, I suspect that trial is probably not for you. But if you're newly diagnosed or in them early years, then there are many research trials out there that can help you.
This is what we mentioned about trying to recognise it early, and that sometimes you don't notice anything, so making sure you go to your regular checkups so we can see if you do have it early and see if we can make those changes.
What's good to highlight as well is when you have diabetes and you're diagnosed, your GP will call for you annually, every year, and they do what's called the diabetes care processes. Now, these include retinopathy screening, foot surveillance, doing your bloods for HbA1c, cholesterol, taking a water sample for you to check your kidneys. All these diabetes process checks are absolutely vital to spot any complications developing. So don't miss them appointments, or if you've got family members it's really important that you go to these appointments. Now, the biggest culprit that people miss is just taking that water sampling and having the foot check. So it's really important you try and encourage that.
Any other questions? Well, all of us are around if you do have any questions. We'll be bobbing on the different stations. So I'd say definitely get round and pick up any resources you find useful. Thank you very much.
Thank you, everybody.
Thank you.
So just before we wrap up, Hina from iScreening is going to say a couple of words about their service and what you might get at their stall. We've also got Living Well. What checks are you doing today, Living Well?
We're doing blood pressure checks and stop smoking cigars.
Fantastic. So go and get your blood pressure checked. It's just a machine on your arm. It doesn't take too long. It's mildly uncomfortable maybe for a couple of seconds, but not too bad, honestly. Go and get that. And then do come and see the research team here. Is it Genes and Health today? Brilliant. So drop in and see the research team and see if you can be involved in some exciting research opportunities. And thank you all for coming. Thanks.
Hi, thank you for having me. So I'm Hina, I'm from the Diabetes Eye Screening Programme. So every patient that is diagnosed with diabetes will get an invitation to either within the Rochdale area, Nau Bevan or Croft Shifa. Does anybody know or taken their relatives to any of these appointments? So it's important that we obviously have the management, as Laurie said, about the eyes and the feet and the HbA1c. So that management of patients with diabetes, you'll either get a yearly appointment, or if we've detected something, then it'll be closer to 3 to 6 months. Or if you have developed the disease, diabetic retinopathy, then a referral to Rochdale Infirmary within this area. So we also are now on patient portal. So if you're registered on the NHS app, you can change your appointment time, your clinic time. It doesn't matter if you can't make that appointment, we can schedule another appointment. Also available, we've got language line, so English isn't your first language. If you let us know, we'll have an interpreter online for you as well. And also, if your relatives or elderly, someone elderly isn't able to make it, we can help and assist with transportation as well. Obviously, meeting a certain criteria is if they don't go through the patient ambulance service, so we can assist in that as well. So just give us a call, or you can email me, come at the back of the table, and we can have a quick chat. And if you don't understand what you've seen in your result letter, then I can go through and explain a little bit as well in a little bit of detail. But if you do come across anyone, friends, family, and the discussion of diabetes does come up, then do mention it. Have you been for your eye screening? Again, as well, have you been for your foot screening? So encouraging everyone to attend. You won't be say discarded. We're always on a fail-safe, so you'll always get an invitation letter, you'll always get that repeat reminder, so you're never off the radar because you have diabetes. There's always going to be that management there for you. Yeah, so if there's any other questions about diabetic retinopathy, then come and see me at the back as well. Thank you. There's a quick one. Okay. You next.
If anybody would like to self-manage their diabetes and have something to kind of help them, there's an app called My Way Diabetes. It's free to download. There's a leaflet here on how to do that. So it's really, really good app, and we encourage it, particularly around here in Wimbledon and Rochdale, that anybody can use this, and it can be type 1 diabetes, type 2 diabetes, and it helps you self-manage on your own phone. So feel free to take any information or any family members who might want that.